So we're talking about what's my number? We're exploring the Octave MSDA test in MS Care. So here's our agenda for this morning. We're going to talk about what are biomarkers. We're going to talk about the iceberg effect, how are biomarkers used in MS, why are they important in MS, and then we'll talk about our test, the Octave MS Disease Activity Test. What does the score mean? We'll talk about the results and the numbers and what that all means to you. Why are we using the Octave MSDA test? Then we're going to go over some examples of patient journeys using the MSDA in practice. And then we'll go over some questions and then how to contact Octave if you're interested for more information. So, what is a biomarker? Biomarkers are valuable tools in medicine that provide objective information about a person's health, and it helps clinicians make informed decisions about diagnosis, treatment, and disease management. So, it is a biological substance. It is in your body. It can be seen in blood or other bodily fluids, such as cerebrospinal fluid. It also can be seen in tissue, and it is something that is measurable. So, we can actually get a number that tells us what's going on in the body. So, different types of biomarkers. I'm going to give you some examples, not necessarily related to MS, to give you an idea of what biomarkers are. So, in the diagnostic world, what is a good biomarker? So, think of it as something that indicates that you have some sort of condition or disease. Examples of this would be your cholesterol. So, that's how high cholesterol is diagnosed. Another good example is those with diabetes. They look at hemoglobin A1C. So those are blood tests that can be diagnostic. Next, we look at biomarkers that are prognostics. So this determines likelihood of a disease worsening. A good example of this would be a PSA. That is a test that is done to look for cancer or the likelihood of cancer, prostate cancer. Next, we look at biomarkers in regards to safety. So this indicates the risk of an adverse effect. So a good example are this of liver enzymes. So your doctor will check liver enzymes looking for adverse effects from medication. And then last, biomarkers are seen for monitoring purposes. I think the thing that most people know are blood pressure and heart rate monitoring. That is a number that gives you an idea of how you are doing. And then all the tests we already discussed, like cholesterol, hemoglobin A1C, or a PSA, those all are used for monitoring as well to see if our current disease state is stable. So let's talk about the iceberg effect. So most of you with MS have seen the iceberg if you've seen any presentations, and we really know that there's stuff above the water that we see. If you look at it as symptoms, it's symptoms that I can look at you and say, hey, you have these symptoms of MS. You're not, your walking is off, you have weakness. And then there are symptoms and things that are going on below the surface. As you know, if you're thinking of symptoms, below the surface would be like fatigue, memory issues, things that I can't see when I look at you, but you know it's happening under the surface. The MRI kind of goes both ways. So we put that at the water level because sometimes we can get an MRI and we see lesions, but sometimes we're not real sure what's going on and we're not seeing that new lesion, or you've gone to a different MRI machine, or a different radiologist is reading that MRI, or just the disease itself of MS causes changes that don't necessarily show up on the MRI. But underneath the surface, that's where the biomarkers are happening. There is always biomarkers in our body, and they're always active or inactive, just depending on what we're looking at. So under the surface, we talk about our little MSDA submarine collecting all those biomarkers underneath the surface. So let's get specific to MS and how do we currently use biomarkers in MS? So when you're diagnosed, MRI is a form of looking for biomarkers. Those lesions we see on your brain and spinal cord, those lesions are biomarkers. Next, we look for oligoclonal bands. Those are biomarkers that's seen in your cerebrospinal fluid. This helps confirm the diagnosis of MS because many patients with MS do have oligoclonal bands. Next is optical coherence tomography, that's called OCT. If you see an ophthalmologist or a neuro-ophthalmologist, they're going to do an OCT that looks at the retina of your eye, and that again will help us confirm whether there is a diagnosis of MS or not. Prognostic, we do these tests to see how aggressive is your MS. So an MRI is going to show us how many lesions, and an OCT will tell us how much damage has been done. Then for safety purposes, we're using an MRI again to look for changes. So if you're someone who's maybe been on a medication like natalizumab, Tysabri, we're looking for risk of infection by doing more frequent monitoring with an MRI. If you have been tested for the JC virus, that is looking for that risk of the infection of PML. So that is another biomarker that's looking for safety. And then any other blood tests, like I mentioned earlier, liver enzymes, blood counts, whatever your doctor's doing to monitor you and test you for risk, that's what's going to be done with those blood tests. And that goes hand in hand with monitoring, continuing to do those blood tests and MRIs to make sure you are stable. So, getting more in depth about biomarkers and how they're important to MS, we're going to speak a little bit to the pathophysiology of multiple sclerosis. So, I really want you to focus in on these four pathways. We have autoimmune changes. So, we know that MS is an autoimmune disorder. Something's going haywire with the immune system that causes it to attack the person, right? It's not behaving properly. So we see these autoimmune system changes, and then those abnormal cells cause inflammation in the brain and spinal cord. So there's a thing called the blood-brain barrier that protects our brain and spinal cord from those infection and immune cells from crossing over. But for some reason, because our blood-brain barrier isn't working right in MS, those inflammatory cells cross over into the central nervous system. And then this is where the process starts happening with MS, because then they hone in on the myelin. So if we look at demyelination, you can see where that damage is being done to the myelin. Those immune cells are attacking and causing inflammation. And because of that, they leave scars behind. And that's when you see the lesions on your MRI. From there, after that myelin has been attacked and damaged, then you can get actual damage to the axons. So we call this neurodegeneration or neuroaxonal injury is another word you'll hear, but the axons are damaged. They may actually be completely severed or just damaged. But throughout this whole process of autoimmune changes that start in the peripheral system over into the blood-brain barrier, then causing myelin changes and then axonal injury, throughout this whole process, various proteins are being released into the bloodstream. Those proteins are the biomarkers that we are looking for. So let's talk about what we're looking for in the Octave Multiple Sclerosis Disease Activity Test. So what is it? It's really a simple blood test. It's that easy, but it measures 18 biological markers or proteins that are linked specifically to multiple sclerosis. They're looking at these proteins have been analyzed and studied in depth, and we know they correlate with disease activity. So what's going to happen is it's going to give a score. We're going to run these 18 proteins, we get values, and I'll show you examples of that. And it'll come out with a score or a number that says how active the disease is. And it's showing that it indicates inflammation and nerve damage that is happening. And it's important because it gives us more information about your disease. It complements your MRI and it goes hand in hand with whatever symptoms you're reporting or symptoms that your clinician is seeing. It can be tracked over time, just like your cholesterol or your PSA or that hemoglobin A1C. We're going to monitor this over time to see safety and monitoring and efficacy and watch all those things to make sure you're doing okay. And it helps your care team have informed decisions about your care because it gives another piece of information to tell us how you're doing. So it gives you more clarity on how your MS is doing as well and whether your treatment is working. Because we all want to know that I'm okay and my disease is stable. So it's blood sample collection. It gets sent to a lab where it's analyzed, and then it generates a report which will show that disease activity score. So this is an example of the report. It's a lot of information, so we're not going to go in a lot of detail, but I wanted you to see what the report looks like. So I'm just going to point out a couple things. The top part would have your patient information. This is going to be the disease activity score or your number that says how active your disease is. It's also going to show your score over time from when you first had it drawn and to where you are now. Here it shows that overall disease activity score over time, just like it did here. And then these are the different pathways. So remember we talked about the immune system changes, that breakdown in the blood-brain barrier, the myelin changes, and the axon damage. Those are these pathways. So there's also going to be a number generated for those immune system changes and those proteins that are being released. Neuroinflammation, that's when those immune cells cross the blood-brain barrier. Myelin biology changes, that's when things are starting to happen and the myelin's not happy. And then here, the neuroaxonal integrity is where damage is being done. So it's going to show what has already been happening throughout this process. Your report will also list all your individual biomarkers, and that's something your clinician will look at. But what's most important for you is this overall disease activity score. So, in a nutshell, you get this disease activity score. It's going to be between 1 and 10. And this is how it's ranked. So, a low score is 1 to 4, a moderate is 4.5 to 7, and a high is 7.5 to 10. And this means we are looking at the risk of developing a new lesion. So let's talk a little bit more about that. So, excuse me, I'm getting over a little cough. So the MS Disease Activity Test is designed to measure disease activity, but it's also establishing what is the risk for you for developing a new lesion. So if you score in that low range, you have a pretty low risk. Obviously, the lower the number, the lower the risk. If you score in that moderate to high range, you're 4.5 times more likely to have a GAD-enhancing lesion. So that is a new active lesion on your MRI. If you score in the high range only, that indicates that you are 21 times more likely to have a GAD-enhancing lesion. So that's pretty significant. So if you're in that high range, that is something to definitely have a conversation with your clinician about. So what are we doing with these numbers? So ideally, a baseline would be addressed. The score would be gotten at the time of diagnosis, but know that baseline testing can happen at any time. Baseline means this is the first test that you've had. So if you've already been diagnosed with MS, you can still get that baseline test done. Then there's going to be routine monitoring. So that's being done just like you get your annual MRIs or get regular blood work, you're doing your routine assessment. If you have a relapse, you're calling your clinician because you're like, I'm having new symptoms. I think that something's happening. That would be another time to consider it. And then when making treatment decisions. And we're going to get into a little more details about each of these. So, how can we incorporate the Octave MSDA test into current practice? So, let's talk about baseline at the time of diagnosis. What are we doing now? So, your clinician's going to do a clinical examination, checking your reflexes, checking for strength, maybe doing a timed walk. You're going to have an eye exam, you're going to get your MRI, possibly a lumbar puncture to look for those oligoclonal bands, other blood work, or any other tests that your provider feels are important to make that diagnosis. But now we can also add in this MSDA test. So once diagnosis has been confirmed, the MSDA test will help tell us how active your disease is. So quantifiable measurement of disease activity. And this may help choose a treatment that matches that level of disease activity, knowing whether we need to be more aggressive with our treatment or not. And then the MSDA test can be repeated in 3 to 6 months to see how well your treatment is working for you. So next, for routine monitoring, what do we do now? We, you're going in for your normal clinic visits to be evaluated. You report any new symptoms to your provider. You may or may not be due for your MRI because that may be happening once a year. And then you're going to have routine blood work that's done, which includes usually a CBC. We're going to check electrolytes and a urinalysis. But now we can add in an Octave MSDA test. So this is going to look at the current plan of care and help the clinician decide if this is working or changes need to be made. And just like your MRI is repeated on a regular basis, your clinical exams are done on a regular basis, so would the MSDA test be done. And this is going to track changes in disease activity over time. So next, what if you think you're having a relapse? So now what do? You call your clinician and you're like, okay, I'm having this new symptom. What do I do? I'm worried it's a relapse. So they may ask you to come in to be evaluated. They may try to get you in for an MRI, but that can take time. As you know, you might need an approval from your insurance and it may take a while to get scheduled. They're going to bring you in and assess you and see if anything looks different. Maybe send you for blood work to rule out any other cause for your new symptoms, such as a UTI. But then if we add in the MSDA test, if you're having a relapse, that score is going to go up. So that's going to give some real data to say, hey, yes, something's happening here because your score went from this to this. So now we think something's happening. So that can help validate the change that you're experiencing. And then looking at treatment decisions, we currently choose our treatment. You come back in, you report, do you have side effects or not? Um, we're looking at MRI. Right now, we look for MRI changes, right? So we know it's working if your MRI is stable. But every year we wait and see, we do the MRI, and maybe there's a new lesion that says, hey, this treatment wasn't working for you. And you may or may not have had a new symptom to correlate with that. Are you tolerating your current DMT? What is the risk of the DMT that you're on? Are you having more frequent infections? Or is this a safety issue? Or are you at a point in your life where discontinuation is on the table? Maybe you're getting older and you and your physician and nurse practitioner have had a discussion of, do I need to still be on treatment? Throughout all this process, the Octave MSDA test can be incorporated to see if your DMT is working. Are you stable or not? Are there changes happening in your score and it's going up or it's going down? Down's good. Maybe that treatment's working really well for you. But you can repeat that MSDA over time to continue to monitor that. But it is assessing for treatment efficacy. I mean, the bottom line is if your MSDA score is coming down or staying down, then it tells us it's working for you. So this is an example of using the MSDA in practice. So this would be a patient that's newly diagnosed with relapsing remitting MS. You can see that their baseline MSDA score was 8.5. So that's high. So this patient's pretty likely going to develop a new lesion. So on the bottom here, you can see what our current practice is. We're going to start a DMT. We're going to follow up with a clinical exam and then do an MRI. But up here now, we're adding in the MSDA to this practice. So 6 months after starting treatment, this patient repeated their MSDA score, and now they're low at 3.0. That's awesome. 6 months later, it's checked again. It's still low at 2.5. Wonderful. And we haven't even had an MRI yet. So this shows you can already feel some confidence in the treatment that you're on because your score is low and you're not waiting for that MRI to see if you've had changes or not. So another example, and we chose this just to show that baseline may not be at time of diagnosis, that baseline may be right now. You've already been diagnosed, you're already on a treatment. So this patient's already on a treatment. Their baseline score was a 4.0. Having their clinical exam every month, getting their MRI every year, clinical exam every 6 months, not monthly, an annual MRI. But see here, after 6 months, they had a good, stable, low score. But what happened here? So they had their annual MRI, everything looked good, but suddenly there's new symptoms. They checked the MSDA score and it's now high at 7.5. What do we do? Well, this tells us the treatment's not working. So this conversation happens here that maybe we need to change treatment. And so that's exactly what happens. The treatment is switched and they're rechecked 6 months later, and that score is now 2.5, which is low, back where we want to be. So let's go over some frequently asked questions. How can I get this test? So the Octave test must be ordered by a prescribing healthcare provider. So you need to talk to your doctor, nurse practitioner, PA, whoever you see to learn more about how this test can be ordered for you. How long does it take to receive the results? So the doctor will receive the report within 4 to 7 days after Octave receives the sample. So the blood test is drawn, and then they take that, spin it, and send it to the lab to be run. And the lab is in California. And then the doctor will receive those results within a week. So, and then we recommend that you talk to your doctor's office to discuss your specific results. And then how much will it cost? Most patients will pay an out-of-pocket of $99 or less. So the Octave Cares program, this is developed to help it be affordable for all of you. All the financial concerns are addressed. We submit to insurance. We handle all the billing on the Octave side. There's a phone number here to contact if you have any questions. But no, they're very happy to work with you. If you're not sure what it's going to cost, you don't want to have to pay too much, they will work with you to make sure you're in that program to pay $99 or less. And then you can go onto our website. This shows here at octavebio.com. There's a button where you can contact us. There's also a QR code here to read, and you can enter your information, and then someone will be in contact with you. So, what's your number?